Hi, it's Dr. Nick here from Spine and Joint. We're here to teach you a little bit about how to tape with Eprotape. A lot of people will be aware of what kinesiotaping is. So I have a lot of patients coming in to see me, and one of the common complaints is that the tape doesn't stay on for very long. And that's usually a very common mistake that people are making. So the important thing with the tape is, as much as possible, not to touch the sticky part. If you touch the sticky area of the tape, it will lose its stickiness, and then it's going to come off really easily. So the first area we're going to look at is the biceps. So the biceps has two heads, all right? One attaches onto here, and one attaches a little bit higher up. So the biceps taping, and the biceps we know flexes the elbow, all right? It's a flexor of the elbow, and it's commonly injured if you're doing a lot of weights or doing a lot of push-ups. What you'll have is you'll either have a tear of the biceps muscle, which is not that common, or more commonly, the long head of the biceps tendon, which sits in the front here. Tendinopathy or inflammation of a tendon will happen when you use the muscle too much. So she's got a little bit of biceps tendonitis or biceps tendinopathy. We're going to tape her for that. So in order to tape, we always try and measure. When you cut the tape, it's important that you actually round the edges. Now the reason why we do that is because we don't want the edges to get caught on your clothes. That means it'll start to peel up and then it comes off. So that's one of the little tricks that you can do, is actually to round the edges. Okay, now for her, all right, we need to actually split this tape into two. Okay, why? Because there's two heads of the bicep. So you could either use one piece. I like to use a split tape. So all you do is you cut down the middle with a good pair of scissors, okay, to roughly about 5 centimeters from the end. All right, so you can see that we split it. And then what we do is, okay, we go and round these edges as well. Okay, again, so that it doesn't get caught on your clothes and then come off easily. So we take off the sharp edges. Okay, so now we have the split tape. Okay, so it's very easy. The next step is quite easy. You want to tear the tape. So just simply pull, all right, and you tear down here. Okay, and then what we do is we can just pull that off. Okay, now you notice I don't touch any of the sticky parts. So with kinesiotaping, you must cover the insertion, all right, up to the origin. So basically what we're going to do is, okay, we're going to put it down onto here, which is just near, all right, the insertion of the muscle. Okay, and if we want to achieve a reduction in the activity of the muscle, then we tape from the insertion to the origin. If we want a muscle to work harder, we would tape from the origin to the insertion. Now the way to remember that is really easy. If you punch someone, you're using a lot more force. So that means you're going away from you. So you would go from here to here. If you wanted this biceps to be a little bit more active, we would tape from here to there. If we want to deactivate the biceps and take some pressure off the tendon where it inserts, we want to deactivate that muscle a little bit. We're going to tape from away to the middle of the body, to closer to where the head is. We're going to just split the tape like that, and we're going to run at about 50% of the tape's flexibility, okay, and then the rest you just put down without any pull, okay. This side here, okay, again, you can see the little holes in the tape. The more we pull it, okay, that's about 100%, that's about 50%. So when we're deactivating a muscle, so we're treating a strain, we generally pull it about 50%, and we're going to put that down to roughly about there, and then, all right, the rest we're just going to put down without any pull. So it just goes nicely like that. Okay, so what you can then do is you can take some of this and just rub on here, okay, so we can activate the glue. That makes it stickier. Okay, that is for a biceps tendon strain or sprain.